Next, go for physical exercise. I can't just emphasize how important this is. And a very good example is from nobody but the president of Uganda. Watch.
Because I don't have time, I always do my exercise here, or even in my home, in my room. So you start by warming up. You can do as many laps as you want. Count. That 2, 3, 4, 5, 6, 7, 8, 9, 10, 8, 9, 7.
Do you know that your information could be the source of your stress? How often do you check your social media? And where do you get your information? Is it from a trusted source? Dr. Peter Yellowless, Chief Wellness Officer at UC Davis Health, discusses more.
I mean, one of the key things in this whole situation is to get good quality information so that you know why you're acting on something. Very few people will change their behavior or change their activities if they don't understand why, if they don't know why that is. So it's really crucial that people get good information from places like the CDC, the World Health Organization, from good quality professional news organizations, local and national. And this is not a time for getting most of your information from social media, quite honestly. One of the traps here is to spend too much time looking at the news. We all want to be informed about what's going on, but we do not need to be informed every 5 minutes. We do not need to be constantly looking at our phones. It's actually very good to keep in the moment and to ignore news for periods of time, to do other things that are perhaps more interesting, go for a walk, talk to some people, have other sort of interactions that are obviously socially distance-wise safe, but which should take your mind off some of these issues that are going on around us at the moment.
No one deserves to be discriminated against. Health workers too face similar challenges. Let's look at this story.
A recent study found that 6 in 10 doctors surveyed had experienced some sort of biased remarks from their patients about their gender, ethnicity, race, age, or weight. About 16%, or 160,000 physicians in the US, are Black or Asian. And yet the study found the majority of them are targets of patient prejudice when compared to other physicians.
You can't go to a restaurant and say, I don't want to be served by any, Latino waiters. That would violate Title II of the Civil Rights Act. So I thought it was odd that here we have in the medical context this happening all the time.
Patients have the right to refuse care by a physician, but what if a patient refuses care due to bigotry?
I've been an African American woman my entire life, and so experiences that I've had as a physician with racism are not entirely different than experience I've had as a regular person with racism.
The New England Journal of Medicine says for minority healthcare workers, patient expressions of racial preferences are painful and degrading and can contribute to moral distress and burnout.
The bigger, more important issue is what happens when patients are the target of racism, structural racism, interpersonal racism, because they're the ones who are sick and vulnerable entering the system and really need help.
Let's stop discrimination. Health workers, just like ordinary people, face discrimination. But the problem is even worse when it's the patient who faces discrimination. No one deserves to be discriminated against. Everyone deserves to be treated with dignity, with respect, and with fairness.
It is absolutely natural for each of us to feel stress, anxiety, fear, and loneliness during this time.